Hello, everybody. Today we're going to be doing an exercise in working with a new patient. And what I want you to do to get the most out of this exercise is to open up an Allscripts test patient that you've been assigned and try to document concurrently. We're going to be meeting with Joe. Joe is not a real patient. He's not an actor. So again, bear with us. The context of meeting Joe is, again, he's going to be a new patient. He's late for the appointment. You don't have any records. He's not signed any releases of information or the admission packet or the consents for treatment. Come on in. Well, hello, Joe. My name is Dr. John Junker. It's nice to meet you. Today I'll be asking you a bunch of questions, and then we'll be talking about a treatment plan for you and any possible medications.
Well, isn't that nice?
Well, what's bringing you in to see me today?
Don't you know you have my fucking record, don't you?
Well, actually, I don't have your record. Our electronic record system doesn't interface with other electronic records. So we can only see your records if you sign a release of information. Do you think you'd be willing to do that?
I'll think about it.
Well, that would be helpful if you did. I don't want to make a mistake in your care because I wasn't aware of certain aspects of your health.
I don't have any fucking health problems.
So no problems with your heart, your lungs, liver, stomach, skin, joints?
What did I just tell you? I have no health problems.
Do you smoke?
Yeah, 2 packs a day.
And what about alcohol or drugs?
Sober for 2 years. Before that, it was treatment like fucking 20, 15, 30 times.
Okay. So how old were you when you went to treatment the first time, and when about was your last treatment?
14, 15, 17, and then 2 years ago, and a shit ton of times between.
What was your drug of choice?
All of them, but mostly heroin.
Okay. And are you taking Suboxone or Methadone? Do you go to AA, NA?
No.
Any cravings to use?
No.
Okay. So, kind of backing up here a little bit, what's bringing you in to see me today?
Because a fucking asshole judge told me I had to.
Okay, are you like on a commitment or a court order?
Commitment. They locked me up at Abbott for 2 months and let me go and told me I had to come here.
Okay, and when does the commitment expire?
January of 2023.
And do you have a caseworker?
Casey, she's a fucking piece of shit. Sent me into a group home.
Oh, okay. What county were you committed in?
Ramsey.
Okay. And where are you living right now?
People Limited.
Okay, and do you have somebody from there with you, a staff person?
Yeah, she's out in the fucking van texting her dipshit boyfriend.
Are you forced to take any meds?
Yeah.
And what meds are you taking?
Some shot in the ass hurts like a motherfucker, and you're gonna stop that, aren't you? 'Cause it hurts like hell. And then some breathy thing for my asthma.
Okay, do you know the name of that medication they give you in your butt?
It's the shot in the ass one.
Yeah. And are you taking any other meds?
Valium, 20 milligrams 4 times a day. Ambien 30 at night, Adderall 60 3 times a day, OxyContin 20 4 times a day. So you just refill those, and I can go, and we're good.
Wow. Well, I first need to finish this assessment, and then I'd like to see your records from Abbott. In addition, I want you to know that I'm not sure I'd feel comfortable prescribing all those meds to you.
Fucking asshole.
Well, if those are the meds that you really feel like you need to be on, Joe, then I'm not so sure I could be that I would be the right provider for you.
Why not? Why don't you just do your fucking job, order the same fucking drugs I've been on for a while? Do you want me to turn you into the board? Just do your fucking job.
Well, I'm not sure that combination of meds that you're asking for is safe, and it's also not consistent with how I practice.
Well, I guess if you don't mind losing your license, then we're done, right?
Well, again, I just don't think that, that's what I would feel comfortable prescribing for you.
Yeah, another fucking dipshit doctor piece of shit.
Again, I just would want you to know I don't think that combination of meds is safe. It's not how I practice. I'm getting the sense that you sound like you wouldn't be happy with me being your provider. And, if you want to, we could end the interview and you could look at care at a different clinic.
Yeah, people are so fucking dumb. I'm lying. You're full of shit. You should have my records, and you'd know that if you had my fucking records.
Okay, what pharmacy do you know you're using?
I don't know. Ask the bitch in the car. She'll tell you if she can put down her phone for a second.
Are you allergic to any meds?
Haldol, Prolixin, Zyprexa, Risperidone, Seroquel, Invega, Abilify, Depakote, Lithium, and I don't fucking know, a couple other ones too.
So what happens when you take them?
They make me feel like shit.
And who was prescribing these to you before you ended up at Abbott?
Dr. Sesma or something like that at Unity. She's a piece of work.
When did you see her the last time?
I don't know, maybe a year ago.
And why you're not going back to see her for care?
I don't know. They fucking fired me from being a patient there and said I was verbally abusive, and they wouldn't refill my Ambien when I asked them to. They said it's too early, but I let the nurse know what I thought about their fucking bullshit policies, then that I'd have to come over there and tear the place up.
Okay. Well, just for you to know that if you got abusive here, we probably wouldn't be able to continue care with you as well. So why do they give these meds to you? How are they helping you?
I don't know. Ask the governor.
Come again?
I don't know. Governor Walz, he tells me what to do all the time. He tells all the fucking judges to lock me up. He tells me to vote for those snowflake pussy-ass Democrats. I just wish he'd leave me alone. He's kind of fucking up my life right now.
Does he call you frequently?
No, he's on TV, save big money at Menards. It's basically his way of telling me I'm a complete douchebag.
How do you know that's Governor Walz?
Well, Joe Biden's the Antichrist, and he's got power over Walz, who's got power over everybody else, and sends it out through the commercials.
Can you tell me more about that?
No, you probably watch those pussies on CNN and wouldn't understand it if I spelled it out to you.
Okay. Now, with all these things that are going on with you, are you having any problems sleeping?
All the time. The only thing that fucking works is 30 Ambien, like I told you.
And is it trouble falling asleep or staying asleep?
Both.
And about how many hours a night are you getting for sleep?
I don't know, about 2, 3.
Okay. And any naps?
I never need a nap.
And how's your energy level?
Pretty damn good. I'm fucking amped up 24/7, except for 2 hours of sleep.
Okay, and do you have problems with racing thoughts?
Yeah, I can't turn them off sometimes.
And how about problems feeling angry or irritable?
What the fuck do you think? Why the fuck do you think I'm here?
Okay. And do you feel others have it in for you?
Just Walls, Biden, and my old man.
How so?
Well, Biden's the Antichrist. Walls is a complete dickhead, and my dad used to beat the shit out of me all the time.
Can you tell me more about what went on with your dad?
I really don't want to talk about it. The first 10, 15 times I was in the hospital for treatment and other bullshit was basically because of him, and they were trying to teach me how to forget about it.
So, about how old were you when you were first hospitalized?
17, 18.
Okay, and have you been committed before?
Yeah, like, I don't know, 3 times?
And, when you were hospitalized or committed in the past, did you ever have times where you felt like your eyes or your ears were playing tricks on you?
Well, I used to get like messages from God or visuals like when I was watching TV or on the radio or driving that, I'm sent here to kind of save the world. But every time I even talk about that, people just think I'm fucking nuts. So I don't bring it up anymore. But to be honest, I don't get that shit anymore.
Okay. And with all the difficulties you've had, have there been times where you felt depressed?
I don't know. Probably not for like the last 5 years.
Okay. And when you've felt depressed in the past, Joe, have you felt hopeless or had suicidal thoughts?
Yeah.
Okay. Any suicide attempts?
Yeah, I tried to hang myself a couple times. One from the stairs, once from the closet with the belt, another time in the garage.
And when was the last time?
Yeah, 5 years ago.
Okay. And have you been feeling depressed or suicidal recently?
Nope.
Do you have access to a gun?
Nope, and good thing I don't, because I'd fucking pop that judge that sent me a commitment.
Okay, are you serious about that?
Not really.
Okay, have you ever seriously hurt someone?
No, not really, but I might swear a lot and yell a lot.
Okay. With what's going on with you, is there times where you start to feel really anxious or nervous?
Just when I sat down here to talk to you, you kind of creeped the shit out of me, and I think anybody'd be anxious sitting here.
Well, I'm sorry to hear that. I don't mean to make you feel anxious. That's not my intent. Are there other situations that increase your anxiety?
Probably just thinking about when my old man used to beat the fuck out of me.
Okay. Do you ever have like nightmares or times that you feel like the beatings are happening again?
I used to, but not for a couple of years now.
Okay. And kind of switching gears for a little bit, do you have problems with needing to repeat things over and over or check things or wash things repeatedly?
Are you kidding me? I take a shower like once a week.
Okay. Are you seeing a therapist?
No, I don't see a therapist. I think they're all fucking bullshit. Plus, none of them are really can quite think like I do. They're not quite up there. I try to explain things to them, and they're all idiots. They just kind of look at me like, so like psychotherapist, psycho the rapist. Yeah, no. So not worth my time.
Okay. So kind of switching gears here again. Any family members that have a history of mental health or drug or alcohol problems?
I have 3 brothers. They're all addicts. My dad was in the hospital. He was a fucking drunk. Was in and out of the hospital nonstop for being a schizo. When I was 8, I came home to my mom swinging in the rafters. And yeah, so I guess, yeah, our family's kind of fucked up.
Yeah, that must have been really hard for you to find your mom like that.
I don't know what was worse, watching that bitch swing or having my dad beat the fuck out of me over and over and over again.
Okay. How long did that go on with your dad?
I don't know. as long as I could remember until I was like 11, and then we all got shoved into foster shitholes.
How was that?
Not great, but not terrible. You know, you get put in these homes with a bunch of perfect family bullshit, and they want you to eat at the table and hold your fork right, and it was just kind of stupid. But at the same time, I wasn't getting the shit kicked out of me all the time, so I don't know. I think by then I was too fucked up. So I ran away when I was 17 and dropped out of school.
And how far did you get in school?
11th grade.
In any schooling after that?
No.
And how do you support yourself?
Now I'm on Social Security.
And have you worked in the past?
Yeah, I worked some jobs here and there for a year or so at a time, and I don't know, the bosses are all dicks, so I'd quit. And then, I don't know, till like 10 years ago, I was in the hospital, and then I haven't worked since.
Okay. Now, you had mentioned that you ran away from foster care when you were like 16 or 17. Where did you go?
Well, friends' couches, the car, the park, pretty much wherever. I don't know.
And have you ever been married or have any kids?
No, not married. I got 2 kids, 2 moms, but I haven't talked to any of them for like 10 years.
Okay. So, Joe, we're kind of running out of time. What else do you think I should know about you?
Well, if you could just take me off these bullshit meds, order the meds that I'm normally on, and get rid of this commitment crap, then we can be done.
Okay. So there's one thing I want to explain to you about coming into my, being a patient with me, is that before I can accept you as a patient, I'm going to need for you to complete the admission packet. And then I want you to complete some consents for releases of information. And then finally, you'll need to get a med list from your pharmacy. And I want you to really understand this, that if you don't get these things done in 2 weeks, then we'll not be accepting you as a patient. We'll be closing your chart. I'm going to be sending a letter to you about this, but I want you to also inform the staff at People Limited that you need to get this paperwork done. Again, you can do that after we're done here today out in the waiting room. You can get a packet of information to fill out from the staff, or it also can be done online. It was nice meeting you. Do you have any further questions or concerns?
Yeah, just get me off the bullshit meds. Give me the meds I need. Get me the hell out of that fucking dump People's Limited. And no, otherwise I'm good.